Okay, David, accept.
Okay. Good morning. I'd like to call to order the Door County Board of Supervisors on Tuesday, May 26th at approximately 10:10 a.m. Would you please join me for the Pledge of Allegiance to the flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please. Robert, President, Rich.
Todd is
Todd's here.
He's here. Is he here? Do I see him?
Yeah, he's back.
He's here. He's gonna.
There we go.
Okay, we're good. All right, you got all 21.
Okay, 21 are present. Thank you. Presentation of the agenda.
Can we use our buttons? It's easier.
Right now, it just says request to
Yeah,
speak.
let me get,
Okay.
I will get on it. Sorry. Only because I'm not going to be able to hear. Okay.
Gotcha.
Okay, so just remind everybody to make motions, we want to use the motion button on the screen.
Okay. Sorry, my phone.
There we go. Good. All in favor?
Aye.
Opposed? Correspondence. Using unassigned fund balance. Anybody wish to add any correspondence? Public comment. Does anybody in the public care to make a comment? None? Okay. No supervisor's response. Approval of the minutes of April 21st, 2020 County Board Organizational Meeting and the May 14th, 2020 Special County Board Meeting.
Got a motion a second? Does it come up on his end?
No, he's got to look up there.
Oh, he's
Single person. Over.
Any questions on the minutes, changes? Susan?
Under the organizational meeting election of the chairperson, in the second paragraph, it says formal vote ballots cast for vice chairperson of the board, but that's the chairperson part. The next section is the vice chairperson. Is what
election of vice chair.
Anything else? Okay, so all in favor of the amended minutes, signify by saying aye. Aye. Opposed? Carried. And number 9, County Administrator.
Sure. So it was included in your packet. Is this the monthly report? I give a status update of all the major projects that are going on. That is in your packet. I don't know if there's any questions on the monthly report. If not, I'll continue on.
Question? Oh, request to speak.
Oh, is it me?
Yeah, there's no.
1 second.
You get
Okay. We're all right here. Like, okay.
All right.
Yes, thanks. Question on the capital projects. So the Island Interpretive Center, is that just closed to the public? Are we looking to open that this summer, the fall? Is it because of the high water? What's the reason why it's not?
So the question is on the Cana Island. So the Cana Island Interpretive Center is done. We are, we had a meeting, Wayne had a meeting last week with the Maritime Museum staff in terms of what they're going to do. We're actually doing 2 things. One is there's high water, which is causing an issue. And we're working with them on how they're going to use the tractor as far as keeping the social distancing because the water is so high. So I know we had a meeting with, again, last week, and they are planning on, I guess, doing a soft open or looking at doing that, but they are working out, I guess, the details in terms of how they're going to operate the tractor and getting people back and forth.
Okay.
I know right now the buildings will remain closed simply because they have no way of wiping them down in between the visitors. So they'll just be being able to walk outside and look at everything outside.
Dave Enigo?
Under page 11 of the packet, underneath John Miles Park entrance, as we know, there's money sitting there that's been an interest in reusing it for another purpose. We had a meeting earlier this month that referenced another purpose, or is that just not at a stage to have listed here yet?
Sure. So at facilities and parks, there was some discussion. There's the money that.
Oh God, that's $25.
$25.
$25.
Who's this at? Is that Todd?
Oh, better in there.
So anyways, so what was discussed at Facility Park, there was money to CIP project plan for John Miles Park for doing the new gate entrance and some of the fencing. It's not the fencing for the raceway. Then the Fair Board had a discussion. They were looking at maybe doing it for a new stage. And then there was some discussion last meeting too. Actually, there's some repairs that need to be done on the back side of the racetracks. I think it's turn 1 and 2 in terms of the fencing there. But the committee at this point in time also held off on that part of the discussion. So we could go back and do some more research on that. So right now there's nothing at this point in time moving forward with any aspect of the project.
So the next month's meeting will probably, listing will probably just state that there's multiple options under consideration.
Correct.
Okay. Thank you.
Todd?
Public Tower. Aaron.
I'm sorry. Wrong one down. Aaron, sorry.
I have a question. Ken, in regards to the Mill Pond project, where are we at in that? I've had a lot of constituents ask me questions and, they're sending pictures, and I guess in terms of the markers that we're trying to meet and so forth, where are we?
Sure. So if you look at here, the question is, what's the status of the mill pond? As you recall, we're still, while the drawdown went through, the sluice valve is still at this point wide open. As you can imagine, I think it was last week I put in my report, we had that significant rainfall event. So again, the water went up significantly just because of all the rainfall, and now it's also dropping down just as fast. In terms of the spring, I guess we anticipated it going up and down. It will probably still, if it remains wet, you'll still see it go up and down. The main aspect, though, is that it will go through and cycle, and eventually, as it starts getting drier, then it should, again, go back down, and then we'll start to see the drying occur. But again, we need to get through this wet part of the spring for that to happen. So that's kind of the status of where it is right now. Any other questions on the monthly report?
Yes, there's Biz.
Thank you, Mr. Chairman. In regards to the Cana Island project, I believe the county gave money up front so that the building could be completed. And the Maritime Museum is to pay that money back to the county. And is there a time? I would think their revenues are down. Is there a timeline of? Is pay with how much they can afford, or how is that going to get our money back from Maritime?
So that is correct. So when we started the project, the county did front some additional funds for the project itself. We did a financial model. We looked at approximately 3 to 4 years for that to come back. It depends on, I guess, the attendance at the island. So last year, they actually had additional, because we didn't have anything, they actually had a good turnout. So they had some additional funds that went in. But now again, we're down just because they're not open, and we're expecting high waters and all that's to kind of impact our revenues. So my expectation would be we're probably going to be closer to that 4-year mark versus the 3-year mark in terms of the payback. I guess it would all depend on what happens the remaining part of the season in terms of number of visitors. But you are correct. The revenue that comes in for Cana Island, a portion of that goes to the Maritime Museum for their operations, and then a portion of that comes to the county in terms of our agreement. And that's the money that will be coming back, paying back the county for that.
Thank you.
Susan?
Yeah, I would like to see, if this hasn't already been done, I really think it's important that we send the report that was done on the mill pond, plus any pertinent handouts that have come out to all of those county board people who weren't here when we made this decision. Because for them to walk in the middle of this and not have any idea what the heck is going on with all the emails they get is really not fair, for starters. I mean, they might come to different conclusions than we did, but at least they need the background to have an idea.
Thank you for that.
Anybody else on the report? Okay, Ken?
Sure. This under then the COVID-19. We just had a couple of items. One is this matters under consideration. Again, we just met a little bit ago, so I'm just trying to give an update of anything that's of significance. That's in terms of us taking any type of action. The only thing that we've done since the last county board meeting is I did talk with David, and we did authorize up to $10,000 for N95 masks. I know Aaron's online, but I know they're trying to track those down for the past 3 months, and we've not had a good source in terms of a reputable supplier. But I know they're working on that. They did have one source now that was actually confirmed where they're, I think it's called iNotch, is the certified firm that they are certified masks, and we're working on getting those. I do not believe we made the purchase yet. I think it's in progress, but those are for the masks. And again, we're trying to do that mainly because we're trying to get that inventory in back for all the, I guess, public safety sectors. And again, that would be an expense. Hopefully, when this is all said and done, we get reimbursed for that. The only other item that's in progress under consideration is just in public health. As I think I mentioned at Health and Human Services, one thing that we're trying to do is, you can imagine, this is an incident that's been long, and I guess it's going to continue to be long throughout the summer. So normally when you have an incident, let's say it was a tornado, you set up your emergency command center, you do all your operations, and then you cycle through. And if usually it's 2 or 3 weeks, you actually try to get your staffing set up where people can rest and kind of cycle through and get recharged. Well, in this case, we have public health is kind of going through this long cycle, and it keeps on going. And what happened is Department of Health Services, when this first started out, when a community or a county got community spread, they said that you don't have to do any more trace calling. Well, now they reversed that decision, and now they said they want them to continue to do all the trace calling. So anything that's happening right now, anytime we get a positive case, we're calling in public health, and all the staff are coming in and doing all that trace calling. And what we did is when we had some of the staff where we try to, I guess, supplement that with some of the public health staff in terms of helping the call. But I guess right now we're looking for something that's going to sustain us and also try to find a little bit of balance within that department. So we're looking at bringing on, I guess, 2 retired part-time nurses that would be able to help with the call volume. And we're also looking at 1, I guess, full-time, almost like a nurse intern, but then also possibly a true intern that would help supplement our call volume just in terms of when we get all those cases in. We are looking at the projected cost. It's probably going to be, if we have all those people on for the rest of the summer through fall, probably about $25,000, $30,000 as far as a fiscal cost. But we're not, I mean, that's going to vary depending on how much we have in terms of volume as far as calls and what we have to do in terms of that response. And it's going to come in waves. There's going to be certain times where it's really quiet and nothing comes in, and then we're going to get hit. And next thing you know, you're spending the whole weekend calling. So again, I guess we're just trying to build that capacity and also give, I guess, a little bit of relief to our public health staff. So that's, I guess, in the works. I guess no formal, I guess, proposal for that yet in terms of the structure, just because we're trying to get those individuals online for our staffing. But that's just an update on those 2 parts.
Wait, no. Megan?
Sorry.
Thank you very much. If you are able to comment on this, I'm not sure if you'll be able to or not. The lawsuit that's been brought against some members of the county. What is our current position, stance on that, and what sort of support is being given to those individuals?
I will defer that to Grant.
Yeah, we generally do not comment on ongoing litigation. What I can tell you briefly is that we have been working with the Wisconsin County Mutual Insurance Corporation and Aegis Corp, which is the third-party administrator for our comprehensive general liability insurance carrier. They have assigned outside counsel to work in conjunction with my office to address both the notice that was filed and the suit that is pending in federal court.
Can you take just a moment and explain what the suit is? So, I mean, right now it sounds like, in other words, it's against 21 individuals across the state, including the governor. Can you explain that? And it's a federal lawsuit.
Yeah, honestly, above and beyond that, we've not yet seen the pleadings. They've not been served on us, so I'm just reluctant to comment because to some extent we are.
I didn't want to leave the impression that it's only Door County.
No. It's what you described is accurate. There are dozens of potential or dozens of defendants. And it's my understanding there will probably be more that are joined as this goes on. So Door County is just one of many local units of government and also the state that is a named defendant in the federal lawsuit. So,
All right, thank you.
thank you.
Laura?
Question is, with this trace counting that you were speaking about, if we do not, because talking about how that can get so difficult and we're taking on more staff, would that be, is that a recommendation from the state that we're doing that? Or is it mandated? I'm just trying to look at how difficult that can get, especially once they leave the county, how you can't continue to do that trace counting. So there could be a really quick dead end road. So does that affect our reimbursement if we're not attempting to do trace counting?
Actually, I just unmuted Sue. Sue, if you're there, could you maybe chime in on that one?
Sure, I can talk a little bit about it. So actually contact tracing has always been something that's required. They have offered state capability, but the state contact tracers are frankly overwhelmed right now with situations like Brown County. And if we called upon them to do our contact tracing, it would be a minimum of 48 hours delay. And the first 48 hours, of course, is the most crucial. So we have been able to keep up with the contact tracing. It's not something that's going to go away. It's absolutely not in any way optional. As far as out of town people, we would certainly need to follow up with them. Past that, if they are positive cases, their jurisdiction needs to be involved also. Having said that, if they are residing in Door County, it's certainly something we want to pay attention to. So I don't know, Laura, does that answer it?
Yeah, it sounds like it's still mandated to get reimbursement from FEMA. I guess I think it's a good point to state that typically once it's community acquired, you don't do contact tracing because it gets so difficult to do and try to keep up with. And now that the resources are being overextended and 48 hours is the most critical, I think it also goes into I've heard people make comments, well, if they inquire, it doesn't mean I'm going to say. So, I mean, we're getting some of that feedback too. So I just see this as a really difficult situation that public health is in.
So, Laura, just to clear that up, contact tracing has never been in any way optional. What has been optional is some of our other follow-up calls after testing, although those are still recommended by the state. So if you're symptomatic and you get tested, we follow up with you to reinforce isolation and the other instructions. Contact tracing is very much, I don't know how to say it. It's the state has that initiative as high importance along with testing. No reason to do testing if you don't do contact tracing.
So, Sue, can I just add something? You can correct me if I'm wrong. So we've moved from the mitigation stage into the containment stage. So if you have small outbreaks, that's when contact tracing becomes so important. You can't always contact all the community spread, but when you have small outbreaks in a location, that's what you want. That's what public health is trying to get a hold of very quickly and contain so it doesn't become a larger outbreak.
Actually, we get a hold of everybody very quickly, but it's that much more important when it's involved in some sort of outbreak with a facility.
Okay. Anybody else have questions for Sue? Susan.
Is Sue gonna give us a report in general?
Yeah.
Okay.
Sue, do you want to just go into your report then right away?
Sure. I'd be happy to. As of this morning, we're at 38 confirmed cases of COVID-19 in Door County residents. Of those, 18 have recovered. There are currently no hospitalizations in those 38 confirmed. We've had the 3 deaths. Negative tests total 1,020. And as of this morning, 163 tests are pending. I can guarantee you that that number will change. We're getting a lot of results coming in from the weekend. So we still are working 7 days a week at Public Health. Our weekend operations are only what we really need to get done on the weekends, such as contact tracing. We're not totaling those negative numbers or importing from the electronic system any cases that are negative. That can wait till during the week. So those numbers will change. We continue to have 7 staff from other health and human service units spending varying amounts of time helping us with our follow-up calls and contact tracing. As they increase their time and ease back into their more or less regular duties, they will become less available for public health work. So we're working to add capacity. I guess we've been working to add capacity all along. It's not an overnight process. We do currently have a 4-day-a-week LTE RN working remotely. And of course, I'm working with Joe Krebsbach to increase that capacity. I guess that's all I'll say about our capacity. As I said, I believe I said 2 weeks ago, our follow-ups and our contact tracing is much more complicated and extensive. It's frankly increased exponentially from the beginning, simply because people are no longer staying home. They have more exposures. There's more people to call and more people to educate and advise on quarantine. We at Public Health are doing really absolutely nothing but COVID and WIC. And the person mainly doing WIC, of course, is our WIC director, Teresa. Our admin assistant, Casey, spends a few hours a week also helping with WIC. All their appointments are remote. Other than that, all our other programs are on hold. And in the back of our minds is kind of easing into how will we and when will we again resume other programs. For example, this morning we discussed immunizations. That's not going to be resumed anytime soon, but we got to think about this in order to serve the community. So as case counts are increasing, at the same time, the community is reopening. So there's more to do for the long-term planning. With the Let's Safely Reopen guidelines, we've gotten a lot of questions. So we're doing a lot of educating. We continue to be involved with the business community on meetings of the Long-Term Recovery Task Force, as well as the Zoom meetings that are hosted by Door County Medical Center. Perhaps you've seen the Door County Economic Development Corporation's emails. They refer to the program of commitment to cleanliness and safety, and there's a little logo that the business groups created for those who make a commitment to follow the safety guidelines that the hospital and Door County Public Health came out with a number of weeks back. We also continue to communicate on a regular basis, weekly or biweekly, with our nursing homes and assisted living facilities because they're the high-risk facilities. I think that's all I wanted to report, unless somebody has some questions.
We do. Laura?
Okay. Hi, Sue. It's Water Check again. Hey, Sue, question, just want to follow up with you. Last time we had county board meeting, you said there was 2 restaurants that had outbreaks or there was considerable amount of tests being done. Did all those tests come back?
Good question, Laura. Yes, thank you. They did come back. Although now what we're seeing are secondary cases from those restaurants. And I again have to say the Door County Medical Center really went above and beyond to increase their testing capacity. And they actually helped us out by going out in the field and doing some testing. So I have to explain that I am not hearing this at all from my counterparts across the state. Other healthcare systems are, much more, much less community minded. So we are very fortunate. And I'm only saying that because it's true. I'm not trying to butter anybody up.
Then one other follow-up question too, just with you speaking about the programs on what the section of your department and what you're able to do and still do. I would really recommend if you could bring that to the committee meetings and discuss what those programs that are on hold and see what other departments can pick them up. For example, like that well testing that was put on hold when I was on the committee with you, we had discussed that it was put on hold. Perhaps the land conservation with Aaron Hansen, maybe they could take up that program then, because they did quite a bit of that work. So that would just be a good recommendation to go forward with the committee to have those discussions so that that type of work can continue to take place.
So yes, good point, Laura. Thank you. The Land Conservation Committee, Erin and her staff have completely taken that on and are keeping track of that. We've just, they're just doing whatever they can. Other things, such as some of the sanitarian duties, the land use services, John Teichler and Chris Olson, their staff have picked that up for us. I'm not sure how sustainable that is throughout the summer. We'll work with them on that. Other things like the mental health focus group and our suicide prevention initiatives, we have not taken part in that at all. Corey McFarland and some of the other health and human service folks have gotten involved in the mental health focus group meetings and kept that running. So thank you to them. But again, as they ease back into their regular duties, they're going to have less time for that also. So it'll be a slow transition. And, I'm not sure how we're going to make time for that with the current situation, but it's, as they say, very fluid.
Yeah, thanks.
Sue, we have a couple more questions, yeah. Bob?
Thank you, Mr. Chairman. Sue, Supervisor Boltman, first I want to thank you and your staff for the vigilance and the hard work during this unprecedented time in these uncharted waters. Everything I hear is, and everything I see, you guys are doing a great job, and thank you very much. I hear that from constituents as well. You just alluded to a few things in talking or answering Laura's question. I just wanted to, I guess, reiterate, maybe not the right word, but just ask you, you mentioned that you're pretty much focused on this one task. And is there anything, are there public health items that are more imminent than, say, immunizations or a couple of other programs that are going by the wayside, because you're overwhelmed with something else?
I think thank you, Bob. And I think we're in good shape as far as with the help we've gotten from other departments and other health and human services units. And things are, like immunizations, it's expected that those are on hold. And the hospital has also continues to do immunizations. So it's not like our community doesn't have options.
Thank you.
Erin?
Hi, Sue. This is Erin Teichler. My question is in regards to, in terms of testing, it seems like there's been a surge, or there's just varying levels but depending on the need. How many of those are directly?
Is there a microphone back there?
Yeah. Okay. I'm going to start over.
Yes, thank you.
Sue, hi. This is Erin Teichler. My question is in regards to testing, and I'm wondering if you can kind of give a general breakdown into terms of how much you test between facility or restaurant-based versus how much is done in planned in conjunction with every hospital admit, and then even a new thing for nursing homes is having all the employees tested every 10 days. So I was just wondering if that's some information that you could share with us.
That is a really good question. So 2 of the nursing homes in Door County, the scanned and the skilled nursing facility that's in conjunction with the hospital, had all their residents and employees tested last week. And I don't know that it's an every 10-day initiative from the state. Waiting to hear back if, that will be repeated. I'm also waiting to hear from the Dorchester to see what their plans are, because to my knowledge, they did not have their residents and staff tested yet. So that was sort of a one-time thing as far as we know. And as far as, you're right, some of the testing now is done by the hospital that are pre-op people and pre-procedure testing of asymptomatic. We don't do any follow-up with that unless, of course, they turn out to be positive. And there is an increasing number of that, which is, I'm going to use the word again, it's very fluid. The numbers are fluid. As far as facilities and follow-up for outbreaks, that is variable. So about a week and a half ago, we had a lot of testing of those restaurants with positive cases. And we tested, meaning the hospital, tested asymptomatic employees that were close contacts. And so that was also a one-time thing. It just really varies. I don't mean to be vague, but that's the best description I can give you.
Susan?
Hi, Susan Coho. 2 questions. One, I'm wondering what's happening with the beach testing program. And the second is, what advice can you give people as they make decisions about re-engaging with friends and neighbors in terms of socializing, going to people's homes, things like that? We see all kinds of advice about businesses. We don't necessarily see a lot of guidance with regard to what we do with friends and neighbors and family. What are you hearing, or what's your advice?
I'll start with that question first because it's the hardest. And you're right. There is no hard and fast guidance out there. Yesterday, the state came out with updated travel guidance, and they're still saying that they don't advise non-essential travel. They're frowning on that, put it that way. They stopped short of saying if you travel, you need to quarantine. They're just saying monitor yourself for symptoms for 14 days. I think that as far as socializing, it's a very personal decision. Personally, I am not socializing any more than I did for the last couple of months. I'm just, socializing with my family and one close friend. And I'm, here at work with people, but we social distance and wear masks. As far as the beach testing, and I don't recall reading any particular guidance on that, either about personal decisions on whether it's safe. It's not actually. There's still community spread. So how do you know who has COVID and who doesn't? We know that it can be spread for at least 2 days prior to becoming symptomatic. The beach testing program is going to continue as usual. So that will be starting this week. And then the next question is, how do we keep the beaches safe? And that is a really tough question. The DNR put out some guidance this weekend also, and it's just really the social distancing. And I don't know that, how we're going to really make that happen. That's all I have to say about that. Did I answer your question, Susie?
Yeah, thank you.
Vinny?
Thank you. The work you've been doing on this. And I have 2 questions. The first one being, is there a resource you can direct people to for questions about if you have symptoms, but you're worried about your finances and being able to afford a test or to be able to afford the follow-up care that may be required as a result of your test or your symptoms? what are some of the best resources you can give for people to go to if that's something that's preventing them from getting care?
So my first answer is, Vinny, I really hope that doesn't prevent anyone from getting tested. So the Door County Medical Testing site is set up. They don't want us to use the verbiage free, but you're not going to be billed. There's no cost to the patient. They do bill insurances. If you don't have insurance, there's other state funding that they can apply for. So they are not asking anybody to pay out of pocket. And, past that is there any coverage for needed care? I'm frankly not aware of what resources there are, but the COVID hotline would probably be able to help them sort that out. The hospital COVID hotline.
Thank you very, very much. And then my second question, I think is maybe a tough one as well, is what is the guidance to visitors? I know in the past it had said, to quarantine for 14 days if you travel to Door County, but that's clearly not possible for people who are coming for 7 days or coming for a weekend. So if a visitor were to come down with symptoms, do we prefer that they stay here in quarantine or try to get home in quarantine? Thank you.
Yeah, that's another good question. So if somebody comes down with symptoms, we would want them to isolate themselves and get tested. So whether that means they hop in their car and drive home and do that in a safe manner, social distancing and all that on the way home, or to stay, if they're, not feeling up to that, certainly they shouldn't do that. They can certainly get tested here. But the important thing is, no matter where someone is, that they isolate in a safe manner. And that can be also isolating from your family members within your home if you're symptomatic and they aren't.
Thank you.
Dave,
of the two restaurants that voluntarily closed recently, one of them at one point in time the owner was the owner of the other same branded restaurant in town here. I didn't see that one close. My question is, at that time, quite often employees from one building shuttled back and forth between both buildings. I don't know if they're currently owned by the same person or not. Was the other restaurant, we also know that a lot of restaurant employees work between different restaurants. Did any tracking go on as far as the other buildings like that? In particular, this one that was at that time used to be owned by the same entity, and quite often you'd say the same people in each of the buildings in the same day.
Correct. When we did contact tracing, we asked for all employees that would have been in that facility. And as I was told by the owner that they didn't share staff between the two restaurants. But we tested anybody who had been there, including it was an employee I can't remember their title, regional manager or something like that wasn't always at the restaurant.
Thank you.
Bob?
Thank you, Mr. Chairman. Sue, you brought up an interesting topic that's going to cause us some potential headaches, and that is the mention of beaches. Obviously, with the water at the level that it's at, and it's not going down, it's only going up, we have very little usable beach space in the county. I don't know if anybody's gone to White Dunes lately, but unless you walk all the way to the south end of the park, there is no beach. It's all rock. I was at Nicolay Bay yesterday. It's actually surprisingly decent, although pretty narrow. And so this isn't really something, you've got enough on your plate, but I don't know if all of us collectively, or maybe this is something for the visitor bureau people, but if there's any way we can creatively come up with a way to encourage people to do things other than go to the beach. I don't know. Beaches are going to be really jammed this summer. There's no doubt about that. Thank you.
When we've had some municipalities like Town of Sevastopol reached out to us on Friday, and we provided them with some infographics that they could post. I know that Wayne Spritka has had signage posted at the county parks about social distancing. And I know that's, maybe not going to help a lot, but I'm not sure what other measures we would take.
Okay, thank you, Sue. Before we move to the next item, discussion of face masks, we need to go back to public comment. We missed somebody who wanted to make a public comment as it happens about masks.
Sure. So this is just for everyone. I did make a mistake when I did do the thing. There was someone that had their hand raised on chat and it's timestamped, so it was during the public comment period. So I know if Mary Beth, if you're still there, I'll unmute you if you want to make a statement.
I'm here. Can you hear me?
Yes, we can hear you.
Hi, thanks. My public statement is about face masks, obviously. So I started a petition about 2 weeks ago to ask the Door County Board of Supervisors to make a law or public ordinance, local ordinance, to require masks in public places. We do understand that the definition of public places may be fluid and would be decided by the board and not by the petition. We recommended perhaps within 15 feet of anybody you don't live with. We believe that an ordinance or law requiring masks in public places would make our visitors and residents feel safe and not judged for their own choice to wear a mask. It would discourage the shaming of those not wearing masks by recognizing that some cannot for medical reasons, but that if they can, they will because it's required. And then it would take the pressure off of businesses to be the enforcers if they can simply say no mask, no service, or mask up, it's the law, and not have to defend their choice to require masks. And finally, it would ensure that everyone is doing their part to keep Door County safe and open this season, which we desperately need. So we have currently 1,285 signatures on the petition, and the breakdown is about 35% are Door County residents, and the rest are visitors from Wisconsin and 41 other states of the United States. So we're pretty impressed with those results, and we'd like to formally ask the Door County Board of Supervisors to consider creating and passing a law to make face masks or cloth face coverings mandatory in Door County to protect everybody this season.
Okay, thank you. Okay, Ken?
Sure. So, and then this is the last part of the report. I should just check to see. I don't know if Dan's in the peninsula.
Yep. Ken, I'm here.
Did you want to make an update as well?
Sure, I can give a brief update. Good morning, everyone. Dan Kane. Just a couple of things to note on from my side. Emergency management. The Emergency Operations Center, as of last week, still running 3 meetings a week virtually with 24/7 operations online. That's going to be going down. We're going to start having conversations for next week and beyond to go down to 1 meeting a week virtually with 24/7 operations online. And then I guess the 2 things I'll bring up in terms of note that are taking much of my time. The first is we have this morning been able to procure what I'm putting in quotes called a toaster oven. This device is in a toaster oven that's been retrofitted with UV light system that will decontaminate N95 masks at a rate of about 50 per hour. That's one of 10 of those units that were sent around the state. We were able to get our hands on one. And so we now have that resource locally. We think that's going to meet our needs up here in terms of being able to decontaminate our N95 masks to get the most life out of them possible. So we're excited to have that. That's now installed and up here, ready to go. So we'll start getting the word out right away to make sure everybody's aware of where it is and how to use it. And this is not for public use. This is for our public safety and our partners. The other thing is, I know you guys have mentioned, somebody had mentioned something about testing. The big project this week, we put a request in between myself and public health, have put the request into the state for a National Guard community testing site to be established in Door County. That will be a joint county effort between Door and Kewaunee counties. So that site is they're going to start the planning for that site this week in the hopes to have it ready to go for as early as next week, potentially. We have some tentative dates picked. But again, that site is run between support with the National Guard, local public health, and local resources. So together that's run. It's free site. There's no cost. It's all covered in terms of that by the state, and as far as the state and the testing and all that, all the supplies are covered from that way. So it costs the community nothing to get a test on that. So again, more to come on that. You're going to start seeing some messaging going around about that. You're going to start seeing a lot of push for that because public getting the word out is going to be a big part of that, and making sure people are aware that the site is where it is and how to get a hold of it and all the rest of that. So those are the two big updates from my end of the house. I'll be happy to take any other questions anybody has on any of that or anything we haven't touched on yet.
Dan, this is Dave. One quick question. What kind of volume of testing you think that would be?
We can request up to 400 tests per day. We're going to ask for that, the maximum. I can tell you that just, I guess it's not apples to apples, but Manitowoc County recently did their testing sites last week, and they saw about 350 tests a day, roughly. And so between Door and Kewaunee, that's certainly going to increase our numbers, but I would say a maximum of 400 tests per day is what they're allowing us to have. I would expect it somewhere between 200 and 400.
Thank you. We have a couple other questions. Vinny?
Thank you. I was wondering if you or Sue has an update on if there's any antibody testing going on in Door County and if there's any collection of that for use in cases. Thank you.
Sure, I can talk about that. And Door County Medical Center is doing antibody testing. The procedure at present is not to call the hotline. That is not the facility doing this. So antibody testing does not diagnose a case. It does not tell you whether you have an acute illness. Antibody testing, quite obviously, shows whether you've developed the antibodies against COVID. And the procedure, if you feel you want that test, is to call your primary care provider at Door County Medical Center. I think that they would try to accommodate somebody that didn't have a provider there who would call and ask for that test. But I'm not clear on what the process would be, except it is definitely not something they're doing at the 18th Avenue testing site that's across from the hospital.
So Sue, if a doctor recommended it or ordered the test, the hospital can do the blood draw and the test, or they do the blood draw and test it out?
Yes, it's at present it's a mail out, and they're working on getting in-house testing, but it's not quite up and running yet. They told me this morning.
Thank you.
So that would just be a faster process, but you can have it done at the hospital.
Vinny?
Thank you. And do you know if they are accepting like blood donations of people who have the antibody? Are they at that level yet? Thank you.
So there is a center in Appleton accepting blood donations, and I'm quite sure that the hospital could direct you to the specifics of that. It's the Community Blood Center in Appleton.
Thank you.
Sue, can you stick around while we have this mass discussion?
Absolutely.
Thank you.
So I know there's been a lot of discussion on the face mask, so I just would talk with David. I just put it on the agenda just for open discussion in terms of any comments or concerns. I know from our standpoint, in terms of our operation, as we slowly start to open the building, we're requiring individuals to wear a face mask as far as the employees when they're interacting with the public or interacting with other employees. But if they're in their office space or something like that, obviously they do not need to use their face mask. In terms of, I guess, other general discussions, I know Dan had put together information last week just because there's a lot of questions on the type of mask and how they perform. I know that was put out on Friday in terms of a release, in terms of an educational material. And again, I know there's been discussion at various things as far as the petition for the ordinance and everything related to that, but this is a general item for your discussion. And so, report my end.
Well, since nobody's asked any questions, I'll ask a couple questions that came up up in Sister Bay at the board meeting up there. Biggest question is, if you put an ordinance in place that requires masks, how do people that don't have a mask get the mask? So if they walk into a business and there's a sign that says mask required, does the business then have to provide it? Or does the county have to provide it if they put an ordinance in place? Or is the expectation that every visitor that would come to Door County would have a mask or mask supply with them? The second issue that came up was, how would you enforce that? Everybody's anticipation or outlook on mask wearing, for instance, on the public comment, a 15-foot distance as opposed to the 6 foot that's currently recommended by other agencies. Outdoor mask wearing versus just indoor mask wearing were some of the issues as far as enforcement. And enforcement is in the eye of the beholder. So maybe I don't like the way your mask is or the mask you're wearing, or I think that you're not in a family group. Of course, I wouldn't know that, but who do I call if I'm trying to enforce a mask issue? And it becomes, so those are two of the things that came up in our discussion. But we'll go to Vinny next.
Thank you. I had some of the same questions, just the ability of the county to enforce a mask ordinance and what that would look like and the legality of it is the first part of the question. And then my second part is, if the county were to do that, as far as enforcement goes, I think we probably don't have a clear path of what that would look like. But I'm also wondering, as issues come up at businesses and confrontations come up at businesses that are requesting people to wear them, how would that play out? How do we handle situations like that as a community? And then as a county, if this is something we were to make an ordinance about? Thank you.
Aaron?
Hello, this is Erin Tauscher again. I work at the hospital, and a big part of droplet precautions too is eye protective wear. And so if you can transmit it via eye membranes, through your nose or your mouth, what do we think about that, or Sue or Dan, in terms of eye coverage as well? And I know that just kind of puts more to it. And then my second question is just, I guess, the legality of us being able to have that ordinance. Is that like a full-fledged, we can say that everyone has to wear a mask, or maybe Grant can kind of comment on that? Thank you.
Grant's going to sort of punt and sort of a medical or science question. If I could have somebody with the appropriate letters behind their name raise your right hand and say that it is, from a medical standpoint, necessary to prevent and suppress and control COVID-19, then that's the first step. Second step is identifying public spaces, private spaces, public businesses, private businesses. And the third step would be the enforcement mechanism, because we'll get into later on, it's fairly clear right now that you are left with purely civil remedies. And the scope of attempting to enforce a broad requirement that members of the public, even in public spaces, wear masks and or face shields to protect the eye would be daunting. So I think there's many issues. As it stands right now, it's worth commenting that what we have out there are recommendations and suggestions, and that, at least in terms of what I'm hearing and reading within my peer group, is probably the most successful way. The best way to go about doing this is because it creates public pressure on people to wear face masks or wear eye protection. And I think we're also seeing the up in the private sector now where Costco, Menards, and a number of other businesses don't let you in the door unless you have a face mask on. And they are enforcing it by not allowing people into the store. And that seems to be in large part working. But I think there are some significant difficulties in enacting a broad ordinance requiring individuals to wear a mask in public and or private spaces.
Sue, we have some other questions, but before we go to the additional questions, would you have any comment or statement on mask wearing and usage and, of course, the eye mask?
Sure. So public health highly encourages the use of cloth face coverings as well as social distancing to decrease community spread of COVID. And I certainly applaud any efforts to increase public awareness and the importance of this. The CDC, the DHS, Cleveland Clinic, many experts agree on the wearing of cloth face masks, and I don't think this should be the question. What they do is protect the wearer from possibly spreading the virus to others. So the droplets from nose, mouth are blocked from getting into the air around you, so keeping the virus from spreading. Fabric masks don't do much to protect the wearer from inhaling particles from someone else that would carry the virus. As to the eye shield, I would see that as more needed in a situation without the use of any face coverings. But yes, if there was somehow droplets in the air that contacted any mucous membrane on the face, such as the eye, that would, cause the virus to be transmitted. But if everybody's wearing a face mask, I don't know how that would exactly happen. It would stop a sneeze, right, from spreading, and any further than 6 feet, certainly. And quite obviously, public health would not be able to enforce any ordinance. We would promote education, and we certainly are working to do that. And I had the same questions about enforcement, and I would urge us to carefully consider all the effects of an ordinance, including, I guess, further dividing our community with a controversy about an ordinance. We need to continue to work together to prevent the spread of COVID as best we can.
Okay, thank you. Nissa?
Thank you. One thought I had was, we have rules where if you can't enter into a shop, for instance, without shirts or shoes because of the safety, public health type of issue, and just mainly safety. One thing I would think that we could look at is maybe seeing if there's grants, or if the cost could be passed off on the consumer, and having hotels maybe supply masks for people who stay there. That way you don't have to worry about the individual business trying to cover everyone, and that the cost would be automatically part of your hotel cost. I mean, we already have, for instance, like the Pratt tax and stuff like that. When you stay at a hotel, you indirectly pay for any soap that's put there anyway, or water and stuff like that. And if this would get passed, what kind of signage we would have put up at businesses, just to make sure that people know walking in, if they don't live in the area, that this would be a requirement. Thanks.
Thank you. Vinny?
Thank you. Mine's an extension of the question I asked before. I'm not sure who can answer this, but for example, if a business has a policy you must wear a mask, and someone comes in and refuses to leave and refuses to wear a mask, what is the course of action a business can take to enforce what they're asking people to do. Thank you.
Briefly, they can try to compel the person to leave. If that person won't leave, similar to what we encounter sometimes in the government center, we call law enforcement, because at the point in time where the person refuses to leave a private business when they're being asked to leave by the owner, the law enforcement will come and escort them off the premise.
Susan?
Thank you.
I'm going to throw an idea out here that, I don't know, might be considered foolish or Pollyanna or whatever, that I had this morning as I was exercising. I too question how enforceable a mask ordinance, and I appreciate Sue's comment about that it divides our community more. Now, first of all, I don't know what kind of reaction we had this weekend in terms of our first opening. So I honestly don't know how much people are feeling like, oh my gosh, this is out of control, we have to do something. And that would guide whatever we did. But it's going to be a long, 3 months as we see how things play out, and then hopefully 2 successful fall months for tourism. So my weird idea is weird because it's not something normally that a county does, I think, but we are the one body, the one official body that represents the whole county. If we were to do some media things that raise the level of the discussion rather than look at it punitively. For example, if we printed up a bunch of signs that could be put in store windows and whatever, and simply said, thank you for respecting our community, our businesses, and our people by social distancing and wearing masks. Maybe that and other things could put that public pressure on, and simply, I don't know what concerns we have now, because where I went this weekend in Sturgeon Bay, people did seem to be doing what they were supposed to be doing. Another thing might be to hold a poster contest for kids and have different levels where they take that theme. And then if the winners at the different levels could be printed and posted around the community. There could be, and again, this is weird stuff because this is a teacher talking, not necessarily a county board supervisor, but maybe an essay contest. These are things that are on everybody's mind. You hear it all the time, and it might begin a discussion. We might be able to get the winning essays, maybe an adult division and a high school division. I don't know. I'm just throwing these out there. They might be read on the radio, but they would get people thinking about this as a public good, as opposed to taking away somebody's rights. So I just throw that out there for thinking outside the box, food for thought, and maybe there are other things as well. So for what it's worth.
Before I call on the next two, I just want to add the comment you had made that you saw most people around Sturgeon Bay seem to have masks on. I was involved in a couple things in Fish Creek over the weekend, as well as Sister Bay. And I would say probably 75% of people came with masks and had masks on. And some of them would come into a store and ask. So there was a pretty good compliance with it. But David Engel.
So I was going to state that since nobody had brought up this weekend yet, I was going to bring it up. And apparently you guys live in different parts of the world than I do. Because every place I drove through a northern door, they were not social distancing. Masks were the minor existence. At least one restaurant was fully packed in the outside thing. The restaurant itself was not following the recommended 6-foot separation. I was seeing couples, 3-4 couples at a table together. I doubt that they all lived together. The difficulty I have is a real simple thing. You sit there and watch the national news and even some of the statewide news. This is an effort that would be impossible to enforce. We would not. There are people that will refuse to do it, period. We have businesses that don't feel it's important enough to do the social distancing. I sat and drove by too many of them that like that. It's unfortunate there are people that are perfectly willing to disrespect the other individuals that are also in the same neighborhood. I have also talked to numerous people over the weekend here that and I won't go to that restaurant because look at how packed they are. So there are some sensible people up here. But I would say less than 20% were wearing masks. So how are you gonna, as a county that we are having a lot of tourism activity, people, it's all good and well. I have no issues with the mask. I'm wearing a mask. Obviously, I took it down to speed. How are you going to get the general public that comes to visit us to recognize an enforcement requirement like that if the businesses themselves don't enforce the general safe distancing to start? Thank you.
Thanks, Dave. Anybody else have any comments? Chairman, this is Dan Kane, Emergency Management. Sure, Dan. Just want to chime in one quick thing. This is a topic that our recovery task force at the county level is looking at as well. There has been, if you go to Destination Door County website, they've created a web page called doorcounty.com/open. That's doorcounty.com/open. On there, it has all the guidelines and things that businesses can follow. Also on there, it has a cleanliness initiative pledge, if you will, declaration that businesses can put on their doors. They're looking at getting some printed off to be able to stick to windows and things to show the community that they take the things that we're all sick of hearing now, masks and social distancing and all that, to heart, and that they're taking the pledge to follow and all the rules appropriately and trying to go that way. So I guess to the talk about a possible something putting in the window, that is being looked at, I guess, from that task force level standpoint. So we'd be happy to take any of those suggestions back to that group and maybe work them through there if that would be a benefit, if you guys feel it's a benefit. So I just wanted to put that out there as well. Thank you, Dan. Anybody else? Okay, David.
One more comment as a reminder: every municipality in the state, as of June 1st, will start looking at reissuing liquor licenses. That is an opportunity to provide data to the applicants in suggested format, whatever the Dan or Sue may come up with at the time of acquiring their license.
Okay. Aaron?
This is Erin Tauscher. I was just thinking that a lot of people come up as tourists that have come here for many, many years, and they might not be checking websites. So I guess just this is an idea to throw out for public health is, could we get a billboard that has the same kind of messaging that Susie was saying, like, thank you for being respectful, wearing a mask and so forth. I'm just putting that out there. Thank you.
Thank you. Vinny?
I can see the issues with enforcing an ordinance. And I guess I just hope that we'll keep putting out as clear as we can in as many places that we can, that what is the best for public health and safety as far as wearing a mask goes and protecting people who are working in various businesses that are seeing hundreds of people in a day right in front of them. So if the people are not wearing a mask, then the employee is not protected at all. So I think that that's a very important message if we can get out there the best way we can, because I have heard comments from people coming to visit here that where they came from are requiring masks and do have some enforceable measures. And it was nice for them to have a break from that coming here. So I think we have to have a careful messaging that it's not just, if it's not an enforced ordinance, it doesn't mean that we don't think it should happen. Thank you.
Thank you. Anybody else? Okay, we'll be moving on. Thank you. Pending business and updates, assessment of resolution 2020-19, ratification, alteration, modification, or repeal of March 16, 2020 proclamation declaring a state of emergency.
So again, I put this on the agenda just for discussion because it did come up a little bit at our last county board meeting. I just wanted to kind of go through and clarify kind of what's on the books or how we're operating. So again, there's really two aspects to consider. One is the authority of the public health officer in terms of setting up, I guess, orders. Those orders are independent of our emergency declaration. So the best way I can explain this, for example, is that when we closed down the beaches, we did not establish an emergency declaration. So Sue has the authority under her, I guess the statutes that give her the power to issue the orders to do that independently of an emergency declaration. Likewise, we can also establish an emergency declaration outside the public health. They're independent of one another. So the example I gave is, I think there was one when we had the explosion up at Ellison Bay, or if there was a tornado, we could set up an emergency declaration for our operations. So I just wanted to clarify how those two are separate. The main thing for the emergency declaration that we have on the books right now is it's twofold. One is it allows us to, operate and continue to monitor our costs related to everything we're going through, and hopefully eventually, try to qualify to get reimbursed for that. Again, I'm assuming there'll be years down the line, but again, if we can track those expenses, we at some point in time will be able to try to get reimbursed for that. The other part of the emergency order is allows, in this case, David and I, to make decisions and concur on making a decision on something that we think we need in response to the emergency. So, for example, I spoke with David last week in terms of trying to acquire the maps for that. Traditionally, an expense outside of that, up to $10,000, would have gone through usually a home committee. It could have gone through like public safety, then the finance. And then depending on the dollar amount of the expenditures would ultimately come to the full county board. For the most part, as I reported at the last county board meeting, we have not made, in my mind, significant expenditures in response. It's been hit and miss just in terms of trying to get us ready. But really what's on the books right now is really twofold. For basic decisions that both David and I concur on in terms of expenses. Again, I don't see those being significant going forward or to date in that matter. But then also our biggest thing right now for that emergency order is for us to allow and track expenses related to this response. So I know there was a question before in terms of, how long do we have this on the books, or how long do we have this authority, or keep that open? Again, I guess my advice to the county board would be is that we have it still, operational, or on the books, just in terms of trying to track those expenses. I know, Dan, if you're still on, you can give an update from the state. But I know that's something right now that the state is still planning to leave open at this point in time for the short term.
Yes, Ken, I'm still here. Yes, so we're still under the declaration period, which began in January. From the federal level, the state declared the emergency at a public health level. There was a lot of question around if each individual municipality, i.e. towns, villages, and cities, needed to declare. That was one that was tossed around quite a bit. It was determined that they did not. They were covered under the states, but again, it doesn't hurt to have a local one in place. That I think goes to this point, right? Ken's mentioning, Ken hit it exactly right. The goal of this is to the twofold that he mentioned, to track resources, track expenditures, and to have that emergency authority. So I think you did a good job, Ken, summing that up. But yeah, the biggest thing is really tracking those dollars, because unless you're covered under the emergency, they're not eligible.
So guys, put it down for discussion. This is kind of give us a status for our any questions or comments, or we could discuss it, but I just wanted to clarify that for the county board.
Well, I have a couple questions or comments. As long as we, as the county, administratively and employee-wise, are still working through it, and we're not pulling everybody back in yet, and we're trying to work through all of our plans and programs for employees, isn't that all part of the tracking on the financial side, the additional costs that we would be looking to potentially get reimbursed for?
Correct.
So wouldn't it make sense in that case to continue the order? So in fact, those things can be tracked and captured for reimbursement under the order?
Yes, I mean, from our standpoint, there's just our operations, but then also other things like we have, for example, we still have the recovery facility set up, although luckily we have not had to use it at all, but we do have the recovery facility. I guess in the queue, should we try to, and what I mean by recovery facility is under Department of Health Services, they required the counties to go through and set up what they call a recovery facility. So if you had an individual that was a healthcare worker or something like that tested or was exposed and wanted to go or not have to go home, in regards to expose their family, they could actually request to go to this facility and be put out for the period of time. And again, that was part of the orders from Department of Health Services. We have that set up. We've not used it, but again, that's still in the queue and active at this point in time because it's still the state emergency is still in place. So from my standpoint, we still want to have our emergency in place because those are all recoverable expenses should we ever need or enable that facility, for example. So there's, I guess, there's external but also internal expenses that we do want to track. So I agree with you that it's important to have it still, I guess, in place at this point in time.
Anybody else? David? Can you use the microphone, Dave? There we go.
Okay, I can see the basket.
Yeah, line 39 and 40.
So just right here, just so everyone can hear, the question was is if you look at page, or if you look at the resolution, the original one on lines 39 and 40 had the committee, the subunits were hereby suspended until further notice. And also the last paragraph. I guess I'll defer that question to Grant.
I think as to lines 39 and 40 would be perfectly fine to recognize that the subunits of the Door County Board started to meet again in May. 42 through 46, I think we need that because of the concerns with Wisconsin's open meeting law. And in fact, today's meeting is a virtual meeting, although we're all here. We are not admitting members of the public unless they come in virtually. So I think that one still should stay in effect as long as we're doing these types of meetings.
So what do you need then, a motion to remove 39 and 40?
It could simply be a motion to allow the resumption of meetings of subunits of Door County Board of Supervisors. And again, those are virtual meetings. Those aren't in-person meetings.
Jill puts it up. We can. She's on it.
So how on here can we make a motion that's not?
She's working on it.
What can do? So you got it. It's on your screen now.
Okay. Okay, so we have a motion and a second. Any other discussion on that motion? Okay, so you want to vote on here, Jill, or by voice?
It's up to you. I have it by voice, right?
Okay, we'll do it by voice. By voice vote, all in favor of the amendment of resolution 2020-19 to allow the meetings of subunits of Door County. Will you reread the motion that you have?
To allow the resumption of the meeting of Board of Supervisors?
There we go. I was missing the word resumption.
Subunits. Subunits of the Board of Supervisors.
Okay. So all in favor, signify by saying aye. Aye. Opposed? Carried. Thank you. I'm getting a little glare. I can't see it all the time. David.
I just want to make sure for the general public to understand that while the meetings themselves of the subcommittees have resumed, it is still relatively a virtual style, as Grant was stating. So it's not an issue going back to the general public going back, being able to attend. There will be modifications of all these meetings until the next step.
And even committee members and or public still address virtually the meetings as we continue to move forward.
Right. Thank you.
Next item, and we will take a short break after this next item.
Review, revise, and adopt the rules of order and duties of the standing committees. Starts on page 13.
I can give a quick synopsis for the board. So again, at the last county board, we did not go through the final rules. We made some motions on the floor in terms of the committee appointments, but we did not, I guess, adopt the final rules of order. When we had discussed in terms of potential edits, the main areas that stand out is under the, I guess, rule was the department requires getting a donation. That's been amended to allow department may accept donations up to the amount of $9.99. Then amount above that, it would go then to the committee up to $4,999. And if it's a donation above $5,000, then it would come to the full county board. The other change would be any contracts in excess of 3 years would be reviewed and approved by the full county board. Now, we did add the exception for the airport leases, which those are usually standard 10 years. You'll see that in the summary, but you'll actually see that then actually on page 19 of the rules. And that should cover the primary changes. Grant, is there anything else that I missed?
No, those are the two principal changes.
Okay. David Enigal.
Page 13, right? The packet. Into this, yep. I kept reading over 1 and 1 multiple times. 1A, trying to figure out the intent of the third line where it starts with county board shall be provided notice of any donation, gift, or grant equal to or in excess of $5,000 prior to acceptance. Well, actually, the first parts of it are saying that the department can accept a grant up to $999. The next one says that the oversight committee can accept a donation up to $4,999. But it's unclear as to who has to do the acceptance if it's 5,000 or more, the way I'm reading this. I think the intent is to retain the past procedure of the county board accepting those values.
And what's worth noting about that sentence, David, is that the only thing that changed is the 1,000's been increased to 5,000. It's archaic language that has been interpreted as you have correctly indicated to require a resolution adopted by the county board. You know, we could clean that language up too, but the language of that sentence hasn't changed. It's just the dollar amount.
It's just the way it reads with the additional red in there. It stood out this time around as being out of place to me. So if it's just the archaic concept issues, then if we visit this again someday, we should revise it to correctly recognize it. How many in sub 2A? How many non-commercial hangar sites do we have?
Aren't most of them non-commercial?
30, 40. Correct. 30, 40.
You're right. I don't think technically we have any that are commercial. I mean, TTX is still private. And in my time being on the board, I'm going to say we went through at least 15 of them. We've gone to the 10-year window. Right? Okay. Maybe less. My question is, I would rather see the sentence, except non-commercial hangar site leases agreements may be approved by the Highway and Airport Committee not to exceed 10 years. I don't like leaving the window open to be a 40-year lease agreement. I know it's unlikely, but that's what verbiage says. So I'm wondering if that's a motion I can make, basically to say maybe approved by the highway, except for non-commercial agreements, not to exceed 10 years, may be approved by the Highway and Airport Committee. I'd make a motion to that effect. Could be somebody that would second that.
So what? You're actually making an amendment.
Amendment, yes.
Okay.
That's right.
Do you have a motion and a second, David?
I didn't get the amendment.
David, could you repeat the wording?
Change the insert. Let's see. after amendments, so to be accept non-commercial hangar site lease amendments not to exceed 10 years may be approved. So those last three words may be approved by the, and the other thing is I'd like to see is just the oversight committee. We seem to constantly change these things every time we reconfigure. I'd rather see if highway and airport committee just changed over to the oversight committee.
So could we get that read back?
You have that, Grant?
Yeah, that's perfectly fine.
Okay, so. All right.
So we're changing it from 3 years to 10 years? Can we just have that read back? A.
The 10 years applies to the hangars.
So if you're on page 19,
yeah,
the first part will still remain the 3 years is subject to review. That's for all the other contracts, except non-commercial hangar site agreements not to exceed 10 years may be approved by the oversight committee.
You mean page 13? Or is it not 19 as well?
Page 19 is actual wording. I think
Yes, I've got a different agenda package. It says amended.
Page 19.
Page 13 is a summary of all those changes with the wording, the actual
okay,
wording
yes,
is on
that's right,
page
yes.
19.
I had that area as well.
So the actual wording in the rules is on page 19.
Yeah, sorry.
Okay, so we're going to voice vote on the amendment with a motion and second. So all in favor of the amendment, signify by saying aye. Aye. Opposed? Carried. Okay, that's been put in there. Laura.
Yeah, I have a couple items that I would like to discuss. On page 22, 5A, excuse me as I get there, and that's of our packet. 5A, okay. So this is new to us that we have I would say just $2,000 allowance. Should we be specifying what annual means? So in 5A, it says each supervisor will be allocated up to $2,000 annually for authorized expenses. I asked Grant before the meeting if we have a definition of annual or if there's other times that we use annually in here versus if it's fiscal or et cetera. And the assumption is that it's from April to April, and that's for 1 year. And I didn't know if the other supervisors felt that we should specify what that is, because if there is a supervisor that's appointed, that supervisor may think that it's from annual of their appointment versus annual from April organizational meeting to the annual time. So I'm not sure if there's how other supervisors feel about that, if we should specify how we determine annual of that $2,000 allocation, or leave it as is. Want to have a discussion on that?
Well, the budget runs January to January,
right?
January 31st.
And our organizational meetings is from April to April, or then your 2 terms.
Which is referring to an election term.
Right. So how do we want to define that? Because I think part of this is important in how our time cards are set up is part of that, how they're going to be separating and pulling that out. So what do we determine 2,000 to be? And I don't recall any discussion of that one before we brought this forward.
It would be helpful to clarify that, just so we're all tracking it the same way.
I guess for my 2 cents, the compensation and reimbursement is tied to the term of the supervisor. And that's what immediately made sense to me as you run it from April to April for a year. In each 12-month period, the supervisor gets that $2,000 and it resets at the end of the term and the beginning of the new term. If you did it on a calendar year, you're going to have a situation where at the end of the term, potentially anyways, somebody might not have anything to use during their first 8 months in office if their successor had used up the entire $2,000 in those first 4 months.
Right.
And you avoid that by having it run from April to April. But that was my thought. Not cast in stone.
That's fine. You could also just take off on that. A supervisor could, under that scenario, use $4,000 in a calendar year, because they could go January 1st to April and spend $2,000. And then April 2nd, they got another $2,000 to take to the end of the year. So in that case, they could do a lot of, if that's what they chose to do.
Right. So I think we should specify that.
Can I jump in with a recommendation?
Yep, just one moment. You're up next, Bob. Okay, Bob, sorry.
Well, and I had another reason to be in the queue, but I didn't know how to handle the discussion. But I'm wondering, could we just replace the word annually with per year of service? Is that clarified enough?
Well, then it could be going from the appointment year, the appointment date to the appointment date versus the term of office.
Oh, please don't go there.
I think if we wanted to run it from April to April, you could just put in parentheses after the word annually, April 1 to March 31st.
I'll make that motion.
Is there a second? There you go, second by Aaron. All right, we have a motion second to make that amendment to say that it will be annually from April 1 through March 31st.
Mm-hmm.
We'll do that by a, oh, sorry, wait more. Are you done speaking?
Yeah.
Okay, Dave Enigal. I'm sorry, no, Bob Bolton.
I'll defer. I have another point to bring up about something else. So I'm done with this.
Okay.
I do want to thank you.
All right, David.
Just my personality reminder, we don't actually start our term on April 1st. We start our term on the third Tuesday.
Yes.
So again, we're creating a similar issue with the first 3 weeks in April.
April to April?
Term to term, $4,000 term to term.
Or organizational meeting. April to April.
Much like my previous question, maybe we just leave this one alone so we seem to understand where it's supposed to be.
Well, that's why I brought it up for discussion, because somebody could take more if you're, depending on how you're defining annually.
Well, you can also make an argument that dollar-wise, the county operates on a budget based on January to December.
Right, exactly. So somebody could take 4,000.
You can do it either way. But
yeah.
The question is, when do you start? When the end of the year? That's what the real question is. So, do we start in April? Or do we start in January?
And I put a motion on the floor for April.
There's a motion and a second for April. So we'll vote on the amended by voice vote to make it April to April or April to March. All in favor?
Aye.
Opposed? Carried. April to April. Okay. Now, Bob, did you want to?
Are we done with that item? That topic?
Yes.
Okay, I'm sorry. Trying to keep track here.
Yeah.
I appreciate the amendments in as far as the donations to departments and gift the grant amendment. Rules of Order 38 donations, gift the grant amendment. I think it makes common sense. I think I would like to, just as a supervisor, I still would like to know and hear about and have reported upon when those things are coming across, at least the sizable ones. And I don't know if that needs to be codified. Again, this is another one I'm just throwing it out there for everyone to discuss. But I mean, if a committee is accepting a donation of $5,000, I would certainly like to hear about that. If I'm not on that committee and wouldn't know about it potentially otherwise. So I don't know if this is just something that we make an understanding that we sort of, and we talked about this before, making the committee reports more of a common thing, and that maybe the committee report is committee report. Again, I'm throwing this out there for general discussion. I personally would like to know that even though we're upping these amounts, which again, I think makes common sense, is there a way that we can still have them reported on, or at least to a certain level reported on, so that the full board knows, can follow the progress and know what's going on?
I guess the only question I have for you, Bob, is we do an annual report of all donations, and that is provided to all county board supervisors. So I guess what we would normally, well, before, if they were under 1,000, that's still part of the report that you have in terms of, so you are reported on all those. I guess the only thing would be different is that I wouldn't report it each month, but we track them and we still give you that report when we do that report for the county board of all the gifts and donations.
Right, and I understand that there's an annual summary. I guess I'm looking at more of a month to month. When you're not on a committee, it's easy to not know things are going, what goes on. I don't know. And like I said, I don't need to know about every $10, but it just seems like a $5,000 thing. It'd be nice to know about month by month. And if that's something that we could just make the committee, that's given in the committee report every month, or I mean, I don't want to wait till the end of the year, kind of thing. I guess that's what I'm getting at. But again, it depends on everybody thinks. If everyone's fine with it, I'm not going to go through it.
Ken?
So Bob, I guess I want to assess county board again. This is one of those things where again we're trying to figure out how to best manage time and resources. So again, it'd be part of the agenda. It'd also be part of the minutes. So if you're monitoring, watching those, you'd actually see that in both of those. So I guess for me to come back and report them again is kind of becoming redundant. I mean, if we're going to, the whole idea of this request was from the county board because we had so many of these coming through to raise those limits, and people are comfortable with watching them, the minutes and the agenda. So I guess if we're going to change that, I'd say whatever you want me to do and report out each month, it should be, or have come to the board, it should be in the rules that way, because is $4,500 significant to you, but not someone else? Is $2,500 significant? I don't know what the cutoff is, and now you're just kind of putting me out there to kind of guess what you want. So right now, I'm telling you, if it's above 5,000, just come to the county board. Otherwise, if it's under 5,000, you're going to see it in the report. Otherwise, track it yourself in the agendas and minutes. So it makes it much black and white in terms of how I'm being consistent with everything. Otherwise, I'm just kind of guessing what you think I want, and it's not a good spot.
And I totally appreciate what you're saying. I by no means am asking you to do more work. I'm asking the committee chair to make a monthly committee report that we have near the bottom of our agendas on every month that we really don't have committee reports. And I think it'd be a good thing if we had a monthly committee report from the committee chairman. Chair. Not you, Chair. I'm not asking you to do more work.
Chair.
Thank you.
Okay, thank you. Anybody else on this?
Can I do a request? I don't have the option. Do a request.
Go ahead, Laura.
Okay, now it's okay to do it this way. Just two more items. So page 30 for the RPC. Let me get there. So that oversight committee has 5 committee members. I wanted to inquire and have some discussions on how we decide on that 5. So in the last year or two, I've had constituents and people, residents of Door County, inquire to me that they feel that there is a lot of power or decision-making authority happening at that committee level, and they feel that there should be more than 5 people representative for the county on that. So that would be a healthy time to have that discussion if that needs to go reviewed for back to committee or how we ever came up to 5.
I'll defer that one to Grant, parts of history. It's been 5. I know.
Yeah, it's been 5 as long as I can remember. I don't recall if we upped that to 7 when we were briefly experimenting with increasing the numbers, but to my recollection, it's always been 5. And my only request is it remain at an even number for decision purposes, because you don't want to have a tie vote.
You mean an uneven?
You mean odd number?
Uneven, correct, an odd number. Thank you.
It's not statutory? Like BOA?
I don't believe so. I can look it up on a break. I have the statutes here. The Board of Adjustment is, I believe the Resource Planning Committee is at the discretion of the county board.
If I'm Mary, Mariah's in the peninsula room.
Okay, yes. Mariah?
She should be.
Or is she online?
Mariah, you in the peninsula by chance?
I am. Can you hear me?
Yes.
I'd have to defer to Grant and look at the statutes also. I think it's been 5 since 1968, but I'm not sure the reason.
Okay, we'll look it up. Alexis?
Yeah, I just had a question about the new sustainability committee. There wasn't added processes or.
So Grant and I talked about this. So normally what we have in the, I guess, in your written text are all the ones that are statutorily required in some form or fashion. But then also when we adopt the rules, we also have the attachment, which is not included in your packet, but it's actually the committee attachments. And when we make that adoption of the rules along with that attachment, because it says attachment to addendum, that's where we actually set up some of our other committees that are not written in here. So Sustainability Committee, CATS, and some of our other committees that we have as functioning committees are recognized through that process when you adopted the, I guess, our committee structure. Not every single committee is actually written up or historically has not been written up in terms of our text itself. Just to give you some background.
Thank you.
But I would think also with a new committee, as the committee forms and starts to move forward, you would add or subtract duties and responsibilities based on what the committee is coming up with.
Correct. And then this one comment, this on, before you jump to the next one, this on committee size. So I know when I first started, there was a large number of committees. I think we're all 5. And then what happened is that the county board, during that next period when they had their annual meeting as far as rules, they had thought about trying to get more involvement of the county board at the committee levels. So what we did is we actually went through the process and made most of the committees actually 7. And we did that for a 2-year cycle. And then the next thing came back and said, well, no, we really don't need 7 in all of these. We could probably, on certain committees where we think there's enough, I guess, work or important information going through, leave those at 7 and scale back the other ones to 5. I know, again, I don't think resource planning ever changed though to that 7, but you can see on some of those they are at 7, but then actually some of them did actually go back down to 5. And like, for example, we moved museum up to 7. Now we're in the thing where we changed that back down to 5 as an example. So it's really a matter of the pleasure of the county board in terms of the size of the committees. But I know Grant's also looking up some stuff while we talk.
I can just go back to the Resource Planning Committee is the county's planning and zoning committee under 5969 sub 2. And all the statute says is that the board may create a planning and zoning committee. It doesn't provide the number of size, but as Mariah confirmed, and I suspected it's been that way for a long, long time. And
Okay, so can we change? Okay, so Bob?
Thank you. On page 13, the summary of all of the amendments, we're the number 7 with nothing listed there. That's just the typo of the phone that's going to.
Yes.
Okay.
Biz?
Thank you, Mr. Chairman. In reference to the RPC committee and 5 members, yes, they do have a lot of authority. However, whatever the decision is, there's other options for the people. If we deny what they're requesting, then they can move on. They have an option to move on to another committee. So there's a lot of authority there, but it's not stamped in stone whatever their decision is.
Alexis?
Sorry, back to the sustainability, page 13, number read, it said that the board, the committee will consist of 5 members, but there were 7. That was something that we did during the last meeting, but it did not get reflected on this. I meant to mention before.
I think after this, if we approve this today, then what we did last month and this month will be brought together and the new rules will be issued.
It does look like this packet was probably pasted from the last one, so I didn't have a problem with that. Yeah.
Okay, any other? Go ahead, Laura.
I'm not done with that one yet. So, and also for the RPC, do we ever, when those appointments are being made, do we ever consider from north, south, central?
Absolutely. That's what we did first thing. We figured north, south, central.
But that's just a given. It's not, we don't specify it.
No, just a given. We make sure we got the mix.
Okay, so something to consider going forward.
Not since not all municipalities are under county zoning, we try to make sure that when we go through the election process, the appointment process, that the county supervisors are in areas that have county zoning. And we also have usually 1 or 2 individuals that do not have county zoning, so they are the neutral, if you will, party.
Okay, and then I just had one other item to do a refer to a committee instead of having that discussed today. If that's possible, just do it now instead of waiting on the agenda because it has to do with this topic. And I brought it up briefly before, and that was to update the rules of order for governing on a section for posting of our agendas and the revisions of our agendas in the packets. So we don't actually have, we don't specify how we do that. And in essence,
wait, we don't specify how we do what?
When we do the revisions of the agendas and the packets. So we do the posting, and I'm looking, and I would think that would be more appropriate after number 6, which is on page, I'm having troubles moving, page 14 of our agenda packet. So after it says presentation of agenda, I thought maybe that the admin committee could look at it. So, and I'll just speak on 2 different occasions that something had happened and I had concerns about. So the first and foremost, when we received our new Chrome computers, I was told that our SD drive can be changed and updated for resetting of when our agendas go through, etc. Well, I keep notes on those also. So I, inquired, does that get changed and reset? So how can I preserve that information? And then when there was a revision on the agenda was made, there was a change. And I thought, well, how do supervisors know that those changes are being made, etc.? So I do believe it might have been handled internally on that, on how we go forward. But I thought it would just be best that we actually put something into our rules of order of governing. And also there was an example when we had a finance policy come forward, there's 2 different color codes using it. So typically we always assume, okay, the red is something new we're adding, but there is red and blue being used. So then there's been probably twice just in this the last 6 months that I had to call and inquire and ask questions about, well, what is the red meaning? Is it new or is it the blue new? What's the recommendation coming forward for the committee? So I just felt that if all departments and all committees we're bringing things forward to the county level, the board level, that it's the same or similar. So I don't have to, and other supervisors aren't inquiring and wondering what's different or what's changed, that we just have a policy on that. So if we could have that go to admin. And I just think it speaks to the integrity of what we're doing, especially when it goes to public posting. The public is also notified. If that is clear as mud.
Okay. We'll put it on there.
Does that make sense?
Okay, so at this point, we need a motion to adopt rules of order based on the amendments that we've already voted on. So I got this correct.
So I made a motion.
Yes, we have a motion and a second now. Okay. So by voice vote, all in favor? Aye. Opposed? Carried. We will take a 10-minute recess. Let's get back by 10 after.